When I say talking to a healthcare provider and a mental health professional is going to help you, you got to find ways to deal with and manage your stress. And you need to participate in activities that bring joy and meaning can be also beneficial to your mental health. Welcome to the Health and Healing from the Inside Out podcast with Stephanie A. Wynn, an online health and wellness podcast where I, your host, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. The Health and Healing from the Inside Out podcast is a mixture of special guest interviews from healthcare professionals, IBD survivors, Crohn's survivors, ulcerative colitis survivors, and community thought leaders. Be sure to select the subscribe button and let's start the health and healing process from the inside out. Hey, we are back for another episode of the Health and Healing from the Inside Out podcast. I am your host, Stephanie A. Wynn, and we are here to explore important health topics and share stories of resilience and hope. Today, we are going to continue our discussion on inflammatory bowel disease. Listen, I really want you all to really get some really good information and tips. You know, if you've been recently diagnosed or have been living with inflammatory bowel disease, this is the podcast for you. We are going to focus on mental health and the unique challenges that people with IBD face. So this week's topic is about mental health and inflammatory bowel disease. But before we get started, we're going to talk about having that growth mindset. Your mental is so important when you're dealing with any chronic illness, right? Any diagnosis, your mental is really important. And that is what's going to help you move forward, push through, strive to keep going forward. Like, really, it really is. So again, we're not going to come from a scarcity mindset or a spirit of fear, but of power, love, and a sound mind. And when you have a sound mind, let me tell you something, you can do and accomplish anything. And it's not determined by what the numbers say, right? It's your strength that's going to keep you moving forward. So there are a lot of people who are dealing with mental health, right? Mental illness. And it could be PTSD. And you don't even have to be in the military to have a form of, you could have been in a domestic violence situation. You could have been diagnosed with a chronic illness. Like, that's post-traumatic. You could have gone through a divorce. Like, there's so many things that can be traumatic to a person, right? Let's get into this. So it is important to recognize that inflammatory bowel disease is not just about a physical condition. It can also have a significant impact on a person's mental health. The physical symptoms of inflammatory bowel disease, such as abdominal pain, blood in the stool, diarrhea, can be distressing and can interfere with your daily activities. However, that mental health is real. IBD can affect a person's social and emotional well-being. The physical limitations of IBD make it difficult to participate, in activities, events, or there's a stigma like you may not want to be around people because you may have to go to the bathroom, or you might isolate yourself because of shame. So it's important that people who have IBD prioritize their mental health and seek support if needed, right? So this may be a part of your healthcare treatment plan, like having a mental health professional on your team. It's important that you speak with your primary care physician to see if they can refer. You want the very best, right, on your team. You want, not saying that all mental health counselors aren't the very best, but I'm just saying you got to find the one that's right for your condition, right? So it's important for you to prioritize your mental health and seek support, and seeking support from family and friends, or seeking the help of a mental health professional. Now, sometimes when you're diagnosed with a chronic illness, sometimes we'll use our family and friends as therapists, and they're not. You got to understand that they're not therapists. A lot of times people don't want to hear that you're not feeling well. They don't want to hear it. Even when it doesn't feel well, you got to say, if they say, "How you doing?" "Hey, I'm doing great." You know what that does to your body? That changes the trajectory of how you feel. Like it makes you feel, "Hey, I feel great today." Even when you feeling listen, you feel bad. You got to change your language, right? When I say talking to a healthcare provider and a mental health professional is going to help you, you got to find ways to deal with and manage your stress. And you need to participate in activities that bring joy and meaning can be also beneficial to your mental health, right? It is also important for even broader communities, like to understand the challenge. Like there are unique challenges that you face when you have inflammatory bowel disease. A lot of people didn't understand, like, they would invite me to events or family members would have gatherings and they would be like, Stephanie, you don't want to eat? You don't want any food? And I remember a time where I wouldn't go simply because they were having food there that I couldn't eat. And I didn't even want to put myself in that position mentally. So it wasn't until I worked with my healthcare providers, I spoke with my mental health therapist to get me on the right track, like mentally. Like this thing is so, and as I'm talking about this in this episode, let me tell y'all, every 7 weeks, I fight for my health care. I have to fight because I have insurance. I'm just underinsured. So the treatment that I get, and I don't even think my provider knows that his frontline workers, the treatment, the way they talk to you, the way they go about handling you, like it's not good. It's not good. That's why I'm in such a fight to bring about the healthcare disparities in the African American communities. Because I know for a fact, other people are not treated like I'm treated. And so that works on your mental too. I had a discussion with my mom and some friends and they were like, Stephanie, you fight. You stay persistent with your healthcare. You fight for this. Because I'm underinsured every 7 weeks, there's a hefty out-of-pocket expense, which is upwards of $1,000, right? And so when, you look for scholarships and, you go to the pharmaceutical companies, you ask for help, and some people can't afford that, right? I couldn't afford that. My parents had to pay for that at some point on my journey, right? And I'm only sharing this because I want to relate it back to how important your mental health is. And I remember calling and say, hey, I'm just checking the status of my scholarship. I want to make sure that, everything is good. And, one of the nurses was like, hey, we're going to put you in limbo until we find out. We'll just put you in limbo until we find out what's going on. What? Limbo? Most people would have flipped their lid. Most people would have given up. Most people would have said, you know what? I'm not going to go back to this provider's office anymore because I don't like the way they talk to me and I don't like the way they treat me. And I was even told, you're the only one that has this problem with the scholarship. You're the only one that gets infusion. Everybody else in here gets shots. But you're the only one that gets infusion. I'm like, so my healthcare so you're devaluing my healthcare? My healthcare treatment doesn't matter? So as you can tell, most people mentally would have given up. This is what I fight for every 7 weeks. Every 7 weeks, there's anxiety. Every 7 weeks, there's a problem. And I'm going to continue to fight. This episode is brought to you by the Let's Talk Inflammatory Bowel Disease Health and Wellness Symposium, a health and wellness symposium hosted by the Stephanie A. Wynn Foundation, whose focus is on raising awareness of inflammatory bowel disease, also known as IBD, among African Americans who are disproportionately affected by this chronic illness. The goal of the symposium is to partner with healthcare community partners to support underserved African Americans living with inflammatory bowel disease in their pursuit to live a more quality life. This symposium, it is sponsored by our exclusive sponsor, which is Moffitt Cancer Center, who have come aboard to sponsor and believe in this symposium. We're going to have gastroenterologists there, mental health and wellness clinicians to speak about the importance of mental health when you're diagnosed with a chronic illness such as IBD. And in order for you to get on your journey of health and healing, we'll also have dietitians and nutritionists there to talk about your diet. Now, specifically for Crohn's and ulcerative colitis, it is definitely important. We'll have our exclusive community healthcare organizations, our financial exclusive well-being organization there, and we will also have a healthcare carrier there on site to sign you up for health insurance. Now, listen, this is not the normal symposium where you go and you hear a lot of people talk. We're actually getting things done on top of educating our community. One thing I do know is this: being diagnosed with inflammatory bowel disease, and being in the African American community, our treatment of healthcare is totally different compared to other cultures. And so we are wanting you to join us. Come join the conversation about the IBD healthcare disparities. This is going to take place again Saturday, March the 25th at 9 a.m. at Clearwater, Florida. And it's going to be at the Carroll Hotel. And the information is going to be in the show notes. Now, listen, if you're unable to attend in person and you would like to sponsor or you would like to donate to the cause, I'm going to drop the link in the show notes as well. Without further ado, we're going to get back to the show. And thank you for your time. Peace. There's somebody waiting on me to show up for them. They don't have the strength to fight for themselves. That's why it's important. And a lot of the providers, they're so busy doing what they love, practicing medicine and, dealing with their patients, right? They don't see what's going on the other side. And so we got to have a discussion about this, right? Which leads to me saying your mental health and having inflammatory bowel disease, all of this plays an important part in your treatment. You have to be strong, even in adversity. Even when the practitioners, employees talk to you bad, you have to look beyond that. Because again, if you don't advocate for your health, who's going to advocate for you? You can't depend on your mom. You can't depend on your dad. You can't even depend on your children. You have a responsibility. I'm going to say that again. You have a responsibility to not give up. You got to have a strong mind during this process. And I know it's easy to say things like, oh, I'm so sick. Oh my God, I just want to feel better. Why am I so sick? I know because I said it. I remember going in the doctor's office and said, Doc, you got to help me. Something is happening. I need you to help me. I need help. I mean, I literally almost had a mental breakdown because I'm dropping 20 pounds a month and nobody can tell me what's going on. I'm going to rectal and colon specialists and they're putting me on a keto diet and I'm already dropping 20 pounds. You feel me? So you talk about mental health. Let me tell you something. Having a strong mind, that's called mental wealth. When you have a strong mind and you believe in yourself, you believe in what it is that you're doing, and you're passionate about what you're doing, let me tell you something. There's nothing nobody can do or say to you. The bad behavior with the communication from the medical staff, yeah, I'm talking about this because I know other patients are going through this that look like me. So again, I want you all to your mental health is so important and vital. Stay strong. Stay strong. Do not give up. Know and understand that you will need to get a mental health professional on your team. Remember, people need to know what you're going through. Don't keep silent. Don't suffer in silence. Get you a mental health professional on your team. Speak with your primary care provider, your gastroenterologist. Maybe they all can come together and recommend someone to help you with your mental health during this process. I want to thank you all for joining us on today's episode. If you have any questions or suggestions, please don't hesitate to leave us a comment, a review. And until next time, I am your host, Stephanie A. Wynn. Peace. Thank you so much for tuning in to the Health and Healing from the Inside Out podcast, an online health and wellness podcast where I, your host, Stephanie A. Wynn, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. Be sure to select the subscribe button and let's start the health and healing process from the inside out.